Good evening, everyone. I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us tonight to talk about how to avoid heart attack and stroke and what you need to know about to prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so make a note of this number, 800-859-0957. We'll repeat it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR. So,
we should be on Facebook Live, right?
yes, well, welcome back, all the Facebook Live people. And Siobhan is piping in from Columbus, Ohio.
Tuning in from a scary location in Columbus.
Ready to go on the Star Set tour another week.
Yes, in the middle of rehearsals. But
in the middle of rehearsals, she stepped outside. Go ahead.
Well, what are we talking about this week? What's the news of the day?
The news of the day is basically Dr. Kolender said he's been noticing an increase in young people coming in. Are they coming in for preventative testing, or they're coming in because they're getting sick sooner?
Oh, no. Preventive testing. So this is part of our corporate account.
Oh, well, that's good.
So we mentioned that too.
Yeah.
That we have corporate accounts with companies, and it might be a way to get in.
And so what's a younger age?
They're all in their 30s, like early 30s, and they all have all kinds of inflammation, all kinds of drivers of disease.
What a sad comment already.
It's true. I mean, I'm in that category. I have inflammation and, plaque. So I'm in my early 30s.
Speaking of which, we need to set up a time to do your, physical, review your results.
I did get my physical, but I need to, that's right. We need to go over my results, which will be interesting. But I need to do my second CIMT for this year to see what's changed since the last measurement.
But let's set up a time, maybe Sunday morning or whatever, just to get it in. Or Monday morning? Okay.
Sounds good.
We're scheduling appointments.
I know, right, on Facebook Live, right?
Everyone knows I have an appointment now with Dr. Kolender on Sunday morning.
Well,
so
at least they know that you get the test
stay
done.
tuned for my results. That's right. That's
15.
Right.
Again, I'd like to welcome all you listeners to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we're here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective altogether. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome back again. All the shows are very important to the listeners. It's probably the only venue they have out there to find out about the up-to-date news on what preventative tests are out there. And we have Siobhan piping in from Columbus, Ohio, and taking the calls before she goes on tour. So welcome, Siobhan. Thanks for being on tonight. Dr. Kolender, tell us a little bit about over the Facebook Live section. And for those listeners, anybody who is listening in, you can also tune in on Facebook to the show. But you were talking about the increase in young people coming into your practice. Tell us about that.
Well, first I want to talk about how they're getting to me. So in my practice, we have some programs with corporations to sign their employees up, and access to the practice is provided to employees as a health benefit. So if you're an employer or you work for a company that has a interest in maintaining their employees' health, we actually have a corporate, if you want to call it, executive health program with Rocket Mortgage. And so, some of their members that choose to take this benefit that I offer, they get into the practice through their company. So, there's younger people, and you'd think that a younger person may not care or think, but they come in, and lo and behold, we find a lot of pathology, in this younger group of people. And, I think there's a lot of messages to take. One of them is, if you work in a stressful environment, I think a lot of people work in a stressful environment, then you may be at risk. So I don't want to single out, those employees, but it's across the board. People that come in new to the practice tend to have higher disease issues. And then over the next 1 to 2 years, we're able to mitigate those risk markers that we find.
And get control of it before it gets worse.
Oh, 100%. So it's just amazing to me, when we get young people in, who are 30, 29, 33. So we've just been having people with a lot of labs that measure artery inflammation. They haven't had their CIMTs yet, so I don't have those data points. But one young man in particular, he had multiple elevated inflammation markers. His cholesterol looked like he had insulin resistance, yet his LDL cholesterol was normal. He had elevated uric acid levels and borderline blood pressure, which, means he probably has sleep apnea too. So here's some guy who, had he gone to a normal or traditional doctor, he would not have been identified at risk, because the labs that traditional doctors use to measure risk on this young man were normal, but every other marker was off that they don't see. So, I told them, I'm glad you chose to join, because you would have been missed, and you'd have been told you're okay. You would have been told the usual, exercise more, eat less, which is in one ear, out the other for every single one of us. And, he on his own had 4 different drivers of inflammation that leads to heart disease. And none of them would have been noticed.
Was he in?
He's like 31.
Do you think that it's attributable to stress, or what do you think is the source of all of these issues?
Well, it's just him. It just happens. Here's one guy who has all these things. So it's really not, stress plays a role for everybody. Actually, this guy in particular was very laid back. He's just one of those people that doesn't even know stress exists. So
the point is, he would have fallen through the cracks had he
Right.
stayed with a traditional
Right.
PCP, a traditional doctor with traditional tests. None of this would have been, ascertained. It wouldn't have been found out, and he wouldn't have the availability of the, the pre-screening test and the CIMT and the blood test that detects the 50 different cancers. He wouldn't have been exposed to any of that, and therefore he would have slipped through the cracks, because he already had markers for disease at this young age.
but not the markers that I'll say a traditional doctor would have noticed. So traditional doctors don't always recognize the labs are looking like someone who might have insulin resistance and on their way to diabetes. And this guy had no family history. So, when you don't have a family history, and, you just get ignored. So, he's been to the doctor before, not all the time, but he's been to the doctor and nothing's been checked. So I'm glad he came in, and, and we'll talk about this next segment, which is, and we really haven't talked about this, that, he had an elevated uric acid, and this is a relatively new driver of inflammation that is ignored. But
Does it
new.
show up on the average blood test in the average doctor's office?
No.
There's the point.
Well,
It doesn't-
it's not just a no. This is kind of a travesty, because uric acid is the blood test that's used to measure gout, and now gout is, let's just back up a little bit. But gout's associated with elevated uric acids, but elevated uric acids without gout are ignored. Now we know that is a cause of heart disease.
So it's all connected. Well, let's come back and talk more about that. Very interesting on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a special question and you would like to talk to the doctor directly about what you ought to do to prevent or reverse disease, please call us at 800-859-0957. Again, That's 800-859-0957. You're listening to 760 WJR. So we're back on Facebook. Why are you not on the TV over there?
What do you
Me?
mean,
Are you
why
asking
am I
me?
not on the TV?
No, because usually there's a split screen and I can.
Well, you're not on it either.
No, I understand that, but you're the doctor. I just wondered.
Well, maybe it's just
Well,
so
we are
that we
back
can
on
see
Facebook,
her.
Oh, we can see. Oh, I
Maybe.
see.
Right. It's just so that we can communicate with her.
Okay, gotcha.
I'm guessing. I'm assuming we're on, Mark's taking care of the Facebook directorial issues,
Okay.
like he always does.
Oh, there you
See?
go. There we go. There we go. Just
So
one word. There you
you
go.
have so little faith. You think that Mark's going to not do what he's got to do?
No, I know.
Of
I know
course
that
he
he's
is.
doing what he's got to be doing. I'm just saying we're not seeing it in here, but it's looking good, so I can keep an eye on you. But you know what? I was thinking as you were talking, we didn't have enough time to really go into it. The problem is the blood tests that they're getting in the office of going to the regular doctor. They're too Mickey Mouse.
Well, let's talk. We can go over this. So, the Facebook people are listening to the show, so we'll
Right.
pick this up. It's too much to talk about on Facebook alone. We got to do this on the air. That decisions made by whoever makes these decisions come back to haunt the average person later on because it's just short-sighted. So someone makes a money decision 20 years ago or 15 years ago, and now we're all paying a price for missed opportunities.
So the point of the fact is that all of these primary care physician offices should be doing the type of sending out blood to the blood labs you're sending them to and ordering the blood tests.
Well, we're not excuse me, we're not even talking about like the fancy labs. This is a basic blood test that could be done anywhere by any lab that's been omitted from the standard panel, but now is being recognized as an opportunity to prevent heart disease, but it's off the standard panel. So doctors aren't ordering this routinely because they just aren't thinking about it because they're not doing prevention. So it's not even on the automatic panel because somebody took it away, and I'll blame the FDA. Somebody took it away.
Okay, we'll come back and talk about that because I think everybody needs to know the blood tests they're getting are pretty useless.
Are we on Facebook, Mark?
Yeah, we're on Facebook.
I mean YouTube. Oh,
We're good. Segment 3, rolling along.
gotta keep my mouth shut now. So much good information not being able to be put out.
Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many other chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we are now able to arrest and reverse the progress of these silent killers. We're inviting you to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, over the break while we were on Facebook Live, we continued the discussion about what I call the Mickey Mouse blood test that everybody's getting. And you had one particular patient who would have been totally, had he stayed in mainstream PCP, mainstream seeing your doctor once a year, he wouldn't have even gotten the blood test. And even if he did get the blood test, they're not able to connect the dots. So what do we do to correct that?
Well, let's educate the audience about what it is we're talking about. So we have a caller?
We do have a
Siobhan?
caller.
Oh, sorry,
All right, go ahead.
Siobhan's got a
Let's
caller.
do that
Go ahead.
first.
Thank you. Okay, so let's start with Scott in Dearborn. Scott, what's your question?
Yeah, hi guys. I called in last week, and you guys gave me great information about my brother, about getting an echocardiogram, I believe it was.
Yes.
Heart condition ran in my family. So I'm going to set that up. But I'm wondering, do you know if Blue Cross and Blue Shield or Blue Care Network cover that, or is that coming out of my pocket?
Well,
I guess
hopefully
that's
your
my question.
doctor, your doctor's got to bill a symptom or a physical finding or a diagnosis to go with it, and then it ought to be covered. But if they just ordered it as a screening test, like I just want to see what's going on, then it will not be covered. So they've got to document a physical finding warranting the echo or a condition that you already have. Or that's what they have to do, and they ought to know their way around that. It's the game that has to be played to get things covered.
To check the boxes, and this is like the cart before the horse. It's like the echo is a screening test. So
Well, it's not usually. Usually there's a symptom or there's something going on with an echo. People just don't get echoes straight off. So,
right.
but they don't cover screening. So you can't just say, I want an echo to see what's going on because I got a family history of this or that. That's usually not covered. Now, sometimes family history things are covered, but not often. You've got to personally have a symptom, that relates to needing to have an echo done. So that's why we are playing behind the 8 ball. We are being reactive instead of proactive, is because insurances don't cover tests to screen for disease. That's what we do in our office to identify conditions before they happen and address them to stop them from happening. And catching, wherever you are on the spectrum of disease, we can wind back the clock by employing, an optimal medical program. And so back to what we were talking about before is in the last maybe 5 years, maybe more, maybe 6 or 7, it's been identified that elevated uric acid with or without gout can be causal in cardiovascular disease. So that means if you have an elevated uric acid, that alone, just like diabetes or insulin resistance or sleep apnea or bad lipids or blood pressure, uric acid added to the list of things that can cause heart attack and stroke. So now there's studies that show if you treat the elevated uric acid in somebody who has heart disease, you can reduce their risk of having a vascular event like a heart attack or stroke. The problem is someone, we'll call them the FDA, they took off uric acid off of like the standard chemistry panel. So the uric acid used to be part of the standard chemistry panel. So when I started practicing, it was on there. They took it out.
Well, why would they take it off? I mean, it's a blood draw.
Well, because it's screening. So
Okay.
if it's in the standard panel, now you're screening for gout.
Mm-hmm.
And if you have gout, you can order the uric acid and to check it. But now elevated uric acid causes heart attack, but it's off the panel. So doctors just aren't thinking about, well, I've got to get a uric acid on literally every one of my patients to see if it's elevated. And I can give them colchicine, which is your standard long-term gout medicine, and that will reduce their risk of having a heart attack or stroke on its own, independent of other variables like cholesterol treatments or blood pressure treatments. And the fact that colchicine is a anti-inflammatory drug, really backs up, what we've been saying all along, which is vascular disease is driven by inflammation, and managing the inflammation prevents events like having a heart attack or stroke. So our system, this is just another simple way to demonstrate that our system is so far behind and just not thinking. And this isn't like, oh, elevated uric acid is a brand new thing they found out yesterday. It's been 5-6 years. And no one said, hey, maybe we ought to put this back on, the panel, and we can educate doctors to prescribe colchicine for people with elevated uric acids with or without gout. But no, they're busy doing other things.
I mean, that's kind of an atrocity. You started off, it was included in the blood test panel when you first started drawing blood, and then it was taken off. And now that they have a finding that links it to possible future cardiac events, it's still off. I mean, how do we get it put back on again? Or is the patient once again forced to go on a digging expedition to find a doctor such as yourself that does this type of testing and screening? I mean, that's a lot to put on the population.
Well, when I was in residency and, early in my career, well, until you start practicing prevention, you don't really know any of these things. But back then, we didn't treat elevated asymptomatic uric acid levels. Like, it was just something you just looked at as, well, it's an anomaly. You ask the person if they've ever had gout. If the answer is no, you ignored it.
Mm-hmm.
And until I started practicing prevention and you start learning all of these things that are available, then you say, well, I got to start treating gout. I got to start treating elevated uric acid as if it's gout, because the outcome is significant. And it also goes to show that really any type of inflammatory disease can impact someone's heart condition. Like the caller from last week who said, my wife's got psoriatic arthritis and my doctor didn't know anything about sugar. So,
wow.
Psoriatic arthritis is another inflammatory condition like gout that has a close correlation to heart disease. And there are studies that show that using anti-inflammatory drugs, strong drugs like monoclonal antibodies or other immunomodulators, can reduce heart attack events independent of cholesterol levels, which is really important to know. But again, I don't think most doctors even have any idea, because they're just checking the box.
Well, obviously it's like a puzzle, but I mean, it's far better for the patient to avail themselves of the test and the screening and this medication if needed. But if there's no box to check, what's the patient to do?
Well, these meds are technically generic. Now that's a whole show, which we're not going to talk about the story of colchicine, because it's in my book. You have to wait for the book to come out to hear about that one. But it's really just stories about, examples of why the FDA is such a disaster and really not there to help you. They're really just there to benefit the pharma industry.
Pathetic. Let's come back and talk about that some more on the other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. You're listening to 760 WJR. And we are back on Facebook. That's actually complicated. That was a whole, complicated dissertation about, sort of a, isn't it? I mean, Siobhan, didn't you find that? I mean, you can be educated and still
It
be.
is. Well, no, I mean, what's fascinating to me is that you would think that insurance companies would have the incentive to cover prevention, because it means they have to pay out less later on.
Right,
Well,
right.
let's talk about that during the show. The reality is, when then there's illness and they pay more, they raise the premiums. They can, if they're not paying out, then they have to lower the premiums. They make more money when you're sick. And exactly how that works, I don't know. But when they're spending more money, they can raise premiums.
Yeah, because it just seemed backwards to me. You would think, well, why wouldn't they cover prevention? Because that means that's one less sick person that they have to pay out on later. But clearly it's much more complicated.
Give me a sec. I'll be right back. There's poor service here.
He's going off screen for a moment. Anyway, yeah, very interesting. So, Siobhan, you should bring that question up. I've got it here. Yeah. You should bring that question up, when we get back. But I mean, it's kind of like a hard connection, It's
yeah.
Yeah. But I just think that the average listener is not going to understand, they're just not going to know. And I just think that it's hard to sort of envision this whole connection from A to B to C to D. I mean, it's just really difficult.
Right. Well, there's just a lack of understanding, about how things actually work, within the insurance industry and the healthcare industry. So it's very difficult for patients to understand. It wouldn't make any sense that these things shouldn't be covered, but.
And I don't want to pretend that I really understand how insurance companies work, but you got to respect them that they know how to make money. They know what they're doing. There's not a single loophole in their process where they don't make money. And so I think they're just geniuses at doing what they do.
Mm-hmm.
Geniuses. And if they would make more money stopping you from getting disease, they would do it.
Mm-hmm.
So they don't make money when you're healthy.
Yeah, but see, it's interesting, as Siobhan said, to figure out how are they making money when you're sick.
Premiums. Because they raise the premium on everybody. So things like cancer. So we talk about, how expensive cancer is. Well, the reality is, there's, well, we've got to start the show, but
Oh, okay, we got 1 minute.
there's a lot more people paying premiums than they're paying out big cancer ticket thing. So, and a lot of times by the time someone gets to that area, they're on Medicare. They've got no vested interest in stopping you from not, screwing over Medicare.
So, once again, it all falls on the shoulders of the patient to find the right doctor, really, if you think about it.
Well, bring that up on the show, Siobhan. Just why wouldn't they pay for something?
right.
And you're a
Yeah, no,
Catholic,
it's a good question.
Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here with us tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune into our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Siobhan, let's go back to you. You brought up a point that we ought to share. We talked about on Facebook. Let's talk about it live now on the radio.
Yeah. So for the break, I was just listening to what Dr. Kolender was saying, and it's interesting to me to think that it would make more sense in my mind for insurance companies to want to cover prevention, because that means one less patient that they have to pay for down the line in illness or catastrophic disease. And we were having an interesting discussion about why that is. So I think it would be a good thing to, open up to the listeners now and kind of discuss it.
Well, yeah, I don't want to pretend that I'm an insurance expert by any stretch, but I've got great respect for their ability to make money. And if they thought prevention would make them more money, believe you, you'd all be cured. You'd all have all these tools, but it must be that prevention doesn't make them money because it's not covered. And if they found a way to make more money, they would do it. So I think that, when the costs are higher, meaning you're sick and using medical services that are covered by insurance, and they're able to raise their premiums. And that's really where their income is in the premiums. Plus you're paying, you're paying the deductibles. And so all that is, cash out of your pocket into the healthcare system one way or the other. And that's how that's how they make their money, is premiums. And
right, of course. And then when you're sick, you're right. You've got deductions and copays. You've still always got that.
The cost goes up, your cost goes up, and that's money in their pocket. So,
plus there's a lack of clarity on the actual cost of certain healthcare services. If you go to hospitals, they don't really have a price menu. It's sort of a grab bag of different numbers in a lot of cases, from what I understand.
There's a million books written about this. And, we had Marty McCary on our show. God, it's probably been a year and a half ago now.
Yeah, it is.
The Fox medical contributor. And he wrote a book called The Price You Pay. And it's about that. It's about the variable cost structures and how different hospitals really take on predatory role trying to collect. They're predatory collectors. So here you are at the worst time in your life, and these hospitals set things up so that you think you're in an in-network and you're not. So like you could go to the hospital and they have for example, I'm just throwing this out, the anesthesia group that is hired by the hospital. Well, they might be out of network, but here you are in your in-network hospital, but a consultant that you didn't have a choice over is out of network.
Mm-hmm.
And so it's things like that that really screw people over.
Siobhan, you've got another caller?
Yeah, we have on the line David in Windsor. David, what's your question?
Well, exactly, as opposed to the FDA.
Right.
So unfortunately, the FDA doesn't just oversee drugs, but it's Food and Drug Administration. So they oversee our food. So all of these foods with all kinds of chemicals and preservatives that are, synthetic. And I would say that we were neither created nor evolved to eat synthetic foods. And that causes inflammation in our systems. And even though it's pretty well known to doctors and, even scientists about how badly these things hurt us, the FDA still approves it. Just like they are in regulatory capture to the pharmaceutical industry, they're also in regulatory capture to the, agricultural and the food industries. So they basically, take their money to approve or just, something, and it gets approved to all of our great disadvantage and poor health. So in every possible way, the FDA has failed us and needs to be reconfigured.
Well, that's a loaded answer to probably a loaded question, but we always keep coming back to the government, the FDA, and the pharmaceutical companies and all that. But the average listener out there, I think the first step is availing themselves of a connection with a primary care physician who is going to make sure that they are aware of the screening tests that are out there. That's step number one. What goes on at the higher levels of government, that might be going on for the next 100 years for all we know. But, and they can't rely on, information. They can't rely on, even from their own. What's scary is most of the primary care physicians aren't using the screening tests that you're giving. And so patients are just going down a road, but they're still getting sick. They're still getting ill. They're still getting diabetes. And then when they get all these diseases, most of them it's too late to do anything about it.
Unfortunately, in our listening area, there's a severe paucity of doctors willing to offer the type of care that we're talking about. And it continues, meaning it's very difficult to find a doctor who wants to come in and practice our brand of medicine, even though it's very satisfying and fulfilling, and it's a great way to practice, from my personal experience. And doctors in the Midwest are so afraid to step outside of their little comfort zone, to take a chance, to take a better care of their patients.
Mm-hmm.
And so, you go, where's someone supposed to go, AnnMarie? No one wants to take a chance. They all go, well, I'm going to retire in a few years, or I'm doing okay. I'm making money. I don't need to switch. Well, all of this lazy, really
Apathetic.
apathetic, low initiative, low intellectual curiosity. I mean, and I'm talking about all of them. If you go to a doctor who's employed by the hospital, employed by a company, they're all guilty. So basically, all of your doctors out there, let's put it plain and clear, are really guilty of not taking a chance to take better care of you. When I say take a chance, it isn't that big of a chance to step outside the system. I did it. Anyone can do it. And so you're all stuck with a doctor who might be the nicest man or woman and care about you, but they're gutless. I'm sorry, but it's just they don't even know what they don't know. That's the other part. They don't know what they don't know. And all of you are suffering.
I'm quite sure that they know that in the 5 minutes that they give the average patient that they see maybe once or twice a year and or when they're sick is woefully short in the realm of providing service of any kind, not to mention knowing that the tests that they're giving are Mickey Mouse tests, the stress test and the blood tests that are basically useless at discovering the connections that you've discovered, and talking about the elevated uric acid and hits that connection with heart disease. Your average doctor, your average PCP, your average primary care physician just isn't aware of that and isn't doing the screening. So once again, I come back to patients are out in the cold and have to be their own advocate. So let's come back and talk some more with Dr. Kolender, the other side of the break. You're listening to our special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing tonight and you'd like to talk directly to the doctor, don't hesitate to call 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR.
So this final segment, let's run down like what they got to do.
Patients?
Like, I mean, other than join my practice, but like give them you say join my practice, but I'm going to say for those of you that can't, here's the basics that you got to do. And we've started doing CIMTs off the show again.
What do you mean doing them off the show?
People calling saying, can I do a CIMT? And we're doing them.
Oh, okay. I see. Providing the service. Okay.
We're charging for it.
Well,
we have to because we're not built that way. We're not built to do volume on stuff. So we're going to offer it. And I wouldn't say it's inexpensive to the listeners because it's a one-off. So we're not, we're charging more.
Well, that's different, though. I mean, they're not joining the practice. They really,
Right.
And see, again, coming back to what you've said all along, getting a CIMT and getting a diagnosis or getting these blood diseases and getting a sheet of paper, that's not going to do you any good, really.
You need someone, but I'm going to give them instructions on, this is what you got to do and what to look for, what to ask your doctor for, and we'll, take it from there. They'll just run through it. So,
it's kind of terrible in a way that patients have to be, their own sleuths, that they have to, avail themselves of what tests are out there.
Think about, that's
Go ahead,
great
Siobhan.
that exists. That you're able to do that to an extent because if people are asking for it, that starts the trend. It's about sharing the information and spreading the word in that sense of just knowing the metrics that are really the important metrics that you're not being told about.
Yeah, I just don't know. I don't know, where the solution to this is. It's just kind of pathetic that every single patient, every single person that's out there, and every single patient's got to be their own advocate.
So let's not mention a price because
Oh,
I'm just saying,
Sure.
depending on our level of annoyance, we change the price.
No, but we're not.
Well, Facebook knows that now.
Yeah,
so
that's
Facebook's got
okay.
the
Well,
inside
if we're getting annoyed by the whole, things, then we raise it to make it worth our. Because we're really there to take care of the people who fully commit to the practice and their health. And
Well, the thing is, I just want to say is I've had the CIMT and everybody that I'm connected with has had it, but it's a useless piece of paper unless you're going to go back to a doctor who knows how to interpret it and knows how it fits in with the other spectrum of testing that you're doing. because you're looking at all kinds of off-label stuff and, stuff that's, from one end of the spectrum to the other. I mean, you're like, a sleuth looking for extra things there that the other doctors are not doing. It's just so Mickey Mouse, the testing that they're doing. I mean, it's useless. Just basically, it's almost like putting a Band-Aid on you till I see you next year. Come in, go have a stress test. Let me take my Mickey Mouse blood test. And are we back on again?
Yeah.
Oh, when? 1 minute.
Show's on.
Okay. So what am I coming back to?
Can you help the people out who can't join your practice?
Right. So don't mention money. Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. So, Dr. Kolender, this is our final segment, and we're trying to pull all this news together because once again, I come back to what I come back to every show. It's falling on the patients to educate themselves, to find out what they need, the testing they need to get. They're not going to get it at their normal PCP's office, and they have to search out a doctor like yourself who's a specialist in prevention. And obviously, there's few of you out there, but you did mention over the break and while we were on Facebook Live, as we want everybody to know, you can also tune into Facebook Live for the shows, that you're getting a lot of callers that have become familiar by the names of the tests, the type of tests they need, the preventative tests, and the most popular one, obviously, is the CIMT. And before, you're a concierge practice physician. You spend an hour and a half with each patient. Nobody waits in the waiting room. There's all kinds of benefits to belonging to a concierge practice. Goes without saying, goes without explanation. But as you mentioned on Facebook Live and over the break, you've been getting a lot of calls from patients who are calling in saying, I've heard you talk about the CIMT. Can I just come and get the test? And now you've let me know that, yes, you are offering the test to patients who are just
Callers
that are not patients, but who just want to come in and get the test. So they just call your office, 866 Kolender.
Yes. And I just want to make it clear that, you're not engaging me as your doctor. We're doing this test. We'll give you a few minutes to kind of go over the results, but this isn't a doctor-patient relationship. We're just providing this test, give you some guidance on what you should take back to your doctor and what to do. And that's about it. So, we want to still be able to provide this piece of data for you to follow, but we're not engaging, you just by doing this test as a patient.
Mm-hmm.
Dr. Kolender, what do you think most doctors are going to do with that information if a patient shows up with a CIMT result?
Nothing.
What's happening at that point?
Well,
okay.
So the whole system is based on blood flow. So all of our testing is based on, do you have a blockage that requires surgery? And there's no plan other than to put somebody on a statin if you are below that threshold of needing surgery. So obviously that's not enough because people are dropping dead more and more every year from heart attack and they're having stroke. So, we kind of figure out what to do with the subclinical plaque that no one else seems to know what to do with to stop it from developing into either death or a surgery. So most doctors would look at that and go, well, you don't have a blockage, so don't worry about it. And the reality is no kidding, you don't have a blockage, but you're not providing a plan to manage this person's plaque other than come back next year and
Let's keep
hopefully
an
you
eye
don't
on it.
die.
Right.
Well, if you're still alive next year, we'll do the test again. And that's basically what every cardiologist is doing. They're do the stress test, they do some vascular imaging. Oh, I can't operate this year, come back next year. And the reality is a nice percentage of those people are going to have an event between those tests.
And isn't it true, just to throw this in, interject, that there is a diagnostic cardiac test that they do that is invasive and has a significant risk to it?
Well,
And
they're all blood flow tests. So however you're gathering that information, whether it's invasive or through a CT arteriogram,
right.
or another, an ultrasound that doesn't employ intima media data points, they all are blood flow tests. And so, of course, right, getting an invasive test when you don't have symptoms is, really malpractice these days, because medical management is as good as these invasive procedures. And in my practice, medical management is better.
Right.
So, why would you go through that when you can manage this on your own? And
Right.
when I mean on your own, a combination of specific lifestyle plan and the right kind of medicine.
Well, let me come back to your initial, our opening stage of the show, where you talked about this relatively young new patient who came from one of your corporate accounts, and you found out all kinds of disastrous stuff was going on that he wasn't aware of. It's really, important for everybody to know that they need to avail themselves of these tests, but not only that, but also have a plan to reverse what they've already got or stop the progression of what they've already got. Just seeing a number doesn't mean anything. And I want to remind you of a patient that called in some time ago, and he had gone out and gotten the CT cardiac calcium scoring test, and he had gone ahead and, got a prescription, went to the hospital, got it, called in and said, "What do I do with this?" And you said, "Well, what's your score?" And he said, 2,500. And you said, "Go directly to the ER." I mean, imagine that here's somebody that went out and got the test, but what do you do with a piece of paper with a number on it? Unless you got a doctor that's going to tell you where you go from here.
Well, the reality is, coming back to that, so when someone calls on the radio and gives me some crazy number, I feel obligated to say, go to the ER. But in my practice, I would not send that person to the emergency room.
Well, that's because,
I know who they are,
right.
and I have more data on them. And calcium burden does not predict risk.
Right.
So calcium score numbers don't predict risk. And actually, somebody who has a very high calcium score makes stable plaque. So calcium buildup occurs when there's healing. So they don't have a lot of inflammation because they heal. But someone who heals is more likely to develop a stenosis, but not die ahead of time. But if they don't have symptoms, then they don't have a stenosis, and they just heal quickly. You still have to go through the process of identifying all their drivers of disease, manage those, and still get a CIMT. Like, we have a patient like that who's been on the show, Dave. He's got a 1,000 calcium score, and his IMT is perfect. He has no inflammation markers. His intima media layers are great. And it just means that whatever he had is now healed.
So a patient comes into your practice, like the patient you talked about earlier, who was unsuspecting and not knowledgeable of what he was carrying around inside him. He's definitely at risk. But you mentioned a lot about medical management. Tell the listeners, what do? You can reverse this process. You can stop the process. You can treat the process. So the halt is available once you get the diagnostic test back. But what do you mean by medical management? We've only got a few seconds.
Thanks.
But go ahead. You bring it up a lot.
Right.
I mean, I'm just saying.
It just means that we're not just screening for plaque. We're screening for all the diseases that cause plaque and then addressing them at the moment we find it, not waiting for someone to have other symptoms. So we screen for sleep apnea. We're screening for insulin resistance. We screen for oral health issues. We screen for genetics. We get a uric acid. All of these things that affect someone's artery path, we find and address aggressively right then and there. So even if someone's got a 30% blockage, which is nothing to a specialist, we take that very seriously, find all the reasons they're there, and make sure they don't go above that.
Yeah, you
And
stop the progression of the disease
not just that, but we can reverse it.
and reverse it. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with the practice that provides access to the necessary testing. Call 866 Kolender if you want to know more about this testing. The show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, my co-host, Siobhan Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.